Can you tell your fundus from your cervix? Here's what you need to know so you can understand what's happening inside your body during pregnancy and birth.
Welcome, I'm Ellen Contard.
And I'm Melissa Evans.
We've been supporting growing families for a long time.
We've come to realize that quality childbirth classes are really hard for growing families today, both in terms of calendar and budget.
So we've decided to do something revolutionary. We are offering our full, comprehensive childbirth class series right here.
Please realize that we are not medical providers nor attorneys. We do not practice medicine nor the law.
So use common sense and talk things over with a professional that you trust. But for now, let's go over some basic pregnancy anatomy so that you know what the parts are that we're talking about in the rest of our informative videos.
Your uterus is like a giant muscle balloon that holds your baby during pregnancy. It has fibers that go around it and also from top to bottom. It's sometimes called the womb.
The top of the uterus is called the fundus. Your care provider will measure fundal height from the pubic bone to the fundus to get an idea of your baby's growth and development. The number of centimeters of fundal height should be approximately equal to the number of weeks gestation in the pregnancy. An experienced uterus will sometimes show off and get bigger faster. The number may decrease if the baby engages or drops into the pelvis, the skeletal bowl that holds the baby. It's not an exact measurement, but it's a great starting data point to ensure that baby is healthy and growing.
The bottom part of the uterus is the cervix. This is what opens during birth to allow baby out. During pregnancy, its job is to stay closed nice and tight, but labor contractions cause it to open, giving the baby a doorway out. Sometimes there's so much focus put on the cervix that people think it's a separate organ, but really it's just the doorway to the uterus.
The birth canal, or vagina, is the path from the uterus to the outside world. The perineum is the skin between the vagina and the rectum. If an episiotomy were to be performed, this is the skin that would be cut. Happily, this is a rather outdated procedure and is not common in most areas.
Inside your uterus, you'll find more than just the baby. Your body also grows the only temporary organ, the placenta. The placenta attaches to the uterus and provides transport between mother and baby. It facilitates oxygen and nutrients getting to baby and waste going away. It used to be thought that this was a barrier, but truth be told, it's more of a bloody sieve. The average placenta is about 9 inches in diameter. It's sometimes called the afterbirth because, except in rare and emergency situations, it comes after the birth of your baby.
The umbilical cord connects the placenta to your baby. It's slippery on the outside and it's filled with Wharton's jelly to protect it from compression. It has 3 blood vessels inside, 1 vein to transport oxygen and nutrients to the baby, and 2 arteries to transport waste away from the baby. Some cords only have 2 vessels, 1 vein and 1 artery. They're a little more fragile. An umbilical cord is about 20 inches in length, give or take.
The amniotic sac is an extension of the placenta. It has 2 layers, the inner amnion and the outer chorion, and they seal up and become kind of a water balloon filled with amniotic fluid, a saline type solution that keeps baby nice and cushioned and protected while in utero. This is referred to as the bag of waters, and yes, that is in fact plural. As baby descends, baby's head acts rather like a cork. The water in front is referred to as the forewaters, and the water behind baby is referred to as the hindwaters. Amniotic fluid is replenished pretty darn quickly, so that even if the bag of waters is broken, it's really unusual for a baby to be born dry.
We hope that shed some light for you on how amazing pregnancy is. Were there any bits that surprised you? Let us know in the comments. We love to hear your experiences.
Please like and share this video with other pregnant friends, and be sure to subscribe. We're going to be dropping videos every Tuesday and Friday, and we don't want you to miss out.
Until next time,
Know your options.
own your birth.